Health claims communicate the health benefit of a product. It sets the expectations when taking a health product. Take this product, get this health outcome. In this video, we'll briefly talk about why I'm skeptical about most health claims, then we'll spend some time looking at what a good health claim looks like, and finally, I'll share how to decipher some of these health claims. Most claims from health products, especially supplements, can be vague and misleading. It can be very hard to understand what these claims mean. The challenge is that these nice-sounding phrases can have multiple interpretations. Take for instance this claim for flaxseed oil. It says it supports cardiovascular health. What does it even mean? Cardiovascular disease can be divided into several different types. Are we preventing a specific type or a combination of them? No matter how you look at it, the claim is misleading. It doesn't mean it's a scam, but it won't be the reason I buy it. It also won't be the reason I don't buy it. It might as well be blank. The language of modern medicine is all about being as specific as possible. Flaxseed oil is an example of a cardiovascular supplement. On the other hand, Plavix is an example of a cardiovascular medication. Let's take a look at the health claims associated with Plavix. Plavix, or clopidogrel, is a P2Y12 platelet inhibitor indicated for acute coronary syndrome, which is the acute or immediate version of coronary artery disease. And coronary artery disease is basically when oxygen-rich blood flow is reduced. The chronic version of coronary artery disease is stable ischemic heart disease, in which patients have a form of chest pain associated with exercise or stress called stable angina. Just for some context, now back to the Plavix indication. For patients with non-ST segment elevation acute coronary syndrome, which includes unstable angina, which is the less predictable version of chest pain, as this type of chest pain can happen with exercise or stress, or when resting, and so it is an unexpected type of chest pain. Non-ST elevation myocardial infarction, or NSTEMI for short, is a type of acute coronary syndrome, or in plain English, a heart attack, including patients who are to be managed medically, which simply means patients who are taking medication, and those who are to be managed with coronary revascularization, which is a type of procedure used to get rid of a clot in a coronary artery. Plavix has been shown to decrease the rate of a combined endpoint of cardiovascular death, which is a heart or blood vessel related death, myocardial infarction, which is the general term for a heart attack, or stroke, which is a clot in the brain, as well as the rate of a combined endpoint of cardiovascular death, MI, stroke, or refractory ischemia, which is a returning blood clot of some sort. Plavix is also indicated for ST elevation myocardial infarction, or STEMI for short, and it is the most serious type of heart attack there is. If we were to think about coronary artery disease on a spectrum, STEMI is by far the most serious form, while stable ischemic heart disease is the least serious, generally speaking. Even though that was quite dense, we know how this drug works in the body, we know who this drug is for, and we know what benefit we're trying to get. For all the issues that healthcare has, look at how specific the use of Plavix on patients are. I challenge you to find a supplement product out there that is as detailed as this. There is no widely accepted or standard definition of supporting cardiovascular health. It doesn't mean the product has no benefit. There might be a study out there that has hinted its health benefits, but you wouldn't be able to guess that just by reading the label on the bottle. This misunderstanding of supplements is one of the main reasons that overconsumption of supplements is so rampant in the US. A study found that 34.5% of Americans take vitamin C supplements, but only 7% of Americans have a vitamin C deficiency. We see this across the board in some of the most popular supplements in the US. Health claims need to be specific. Are we replenishing an essential building block of the body, or are we trying to counteract some sort of defect of the body? Health claims specify what input we're getting. Basically, you can't really pay attention to any of the health claims on supplements. They just don't provide enough context on what it could be used for and whether it could apply to your specific situation. But what you can do is do your own research online, reading articles published in scholarly journals. A good starting point is PubMed. These articles are as specific as it gets when it comes to talking about the human body and potential health benefits. The goal is to set realistic expectations rather than trying out every supplement under the sun. The reason why doing research is so important is that the outcome will inform on the next steps. It is important to unravel what these claims actually mean. Once we figure that out, only then can we decide whether to take it. The reason why I'm specifically mentioning PubMed is that you want to get a sense of what the experts in the field are saying. Not only are these articles presenting their findings, but these articles often mention other published articles with the similar topic. Essentially, a scholarly article is oftentimes a summary of many articles. The advantage here is that a single article can summarize the findings of hundreds of experts. In our example, the questions I would want to ask are, what are these experts saying? And based on that answer, will this help achieve my health goals? If there is interest, I'm happy to provide more practical advice on how to use PubMed, but that's enough for right now. Best of luck.